Okay, so here's a list of all of the RNA viruses. That's a really long list. There's many of them, but don't panic right now. Two things we've already discussed about them. They mostly all have a single-stranded genome, with the exception being Rhinovirus, which has a double-stranded RNA genome. And the other thing is that they undergo cytoplasmic replication. The exception for this is influenza and retroviruses. So what I'm going to do is go over these RNA viruses and then emphasize the key RNA viruses. Let's start with the Poliovirus. This may be a popular reference that will be obsolete in a few years' time, but I imagine the Khaleesi from the popular TV series Game of Thrones. Norovirus is an example of Poliovirus you need to know. It causes a gastroenteritis. So maybe just remember that our Khaleesi got viral gastro from Noro. Here's the text to help you remember this. Next are the retroviruses. HIV is the most famous example, and we'll come back to it in a second. HTLV is another important retrovirus. It causes a T-cell leukemia. They are both called retroviruses because they have a reverse transcriptase. When we discuss HIV, we'll talk more about what that means. Next are the coronaviruses. The outbreak of SARS a few years ago was actually a coronavirus. It is a cause of the common cold. This is probably the last thing you want to drink when you have a cold. The filoviruses include Ebola and Marburg. These are often fatal and usually seen in Africa. They cause a hemorrhagic fever. Next we have the Rhinoviruses. This group contains two obscure viruses which are low yield. Their names for completeness sake are LCMV or lymphocytic choriomeningitis virus and Lassa fever encephalitis, which is spread by mice. Almost there. Okay, so next we have the Polioviruses. Of these, hantavirus is probably the most common one you may come across. It can first cause a prodrome of fever and myalgia, but can then lead to respiratory symptoms and pulmonary edema that can lead to ARDS, aka acute respiratory distress syndrome. If you need a refresher on ARDS, take a look at the pulmonary section. But briefly, I think of ARDS as non-cardiogenic pulmonary edema. It is also the only Poliovirus that isn't an arbovirus. It's actually considered a robovirus since it's transmitted by aerosols of deer mice, urine, and feces. Last but not least, we have the Hep virus and Delta virus. Respectively, these include the hepatitis E and hepatitis D viruses. We'll come back to talk about all the hepatitis viruses together. So the negative-stranded viruses include this on this list: Rhinovirus, Poliovirus, Paramyxo, Orthomyxo, Philo, and Rhabdovirus. There's a mnemonic to help you remember this. Always bring polymerase or fail replication. This will help you remember why it's relevant that they are negative-stranded. They carry their own enzymes, such as RNA-dependent RNA polymerase, to describe a positive-stranded complementary copy of its genome. Remember that purified nucleic acid from negative single-stranded RNA is not infectious on its own. If you remember seeing this diagram before, the basic idea is that a negative sense strand needs to be converted to a positive sense strand by the RNA polymerase before it can undergo translation. That is why it is non-infectious on its own. Use the BOAR BOR mnemonic to remember that Poliovirus, Orthomyxovirus, Rhinovirus, and Rhinovirus contain segmented genomes. It is also important to remember that Orthomyxovirus, or the influenza virus, has a segmented viral genome. We've already discussed this when we talked about the process of reassortment. You may recall that segmented genomes are capable of reassortment, which causes genetic shifts and new influenza pandemics. The H1N1 influenza strain of 2009 is an example of an influenza pandemic brought about by reassortment that combined genes from the human pig and avian influenza viruses. Alright, so moving on to the rest of the RNA viruses. We'll start with picornavirus. The picornavirus is a family that includes poliovirus, echovirus, rhinovirus, Coxsackie virus, and hepatitis A virus. As you can see highlighted in red, these first letters spell perch, which can also help you remember their names. Important to remember is that all of the viruses in this family, except for Rhinovirus, which I put an asterisk next to here, are enteroviruses because they are spread by the fecal-oral route and infect the GI or enteric tract. Interestingly, except for Rhinovirus and HAV virus, they can all cause aseptic meningitis. So quick question, do you know what aseptic meningitis is? Well, aseptic meningitis in broad terms is an inflammation of the meninges, hence meningitis, in the brain that is not caused by a bacteria. Okay, so let's start with polio. In the majority of cases, polio infection causes no symptoms at all. When poliovirus does cause symptoms, it may present as abortive poliomyelitis, in which the virus does not affect the central nervous system and produces only a mild febrile disease. When poliovirus enters the CNS, it can cause meningitis-like symptoms or paralytic poliomyelitis in about 1% of cases. Paralysis occurs because the virus preferentially damages anterior horn motor neurons. Here's an image to help you visualize this. This is an image of the spinal cord. This circle shows the anterior horn where the motor neurons are located. If I were you, I would go over and read neurology to refresh your memory on this section if you're kind of shaky on this. Some patients can develop post-polio syndrome several years after resolution of the acute infection, which causes further muscle fatigue, weakness, and atrophy. By the early 20th century, poliovirus had caused major epidemics that were responsible for crippling thousands of people, mostly young children, during the summer months. This image shows the iron lung, which is a negative pressure ventilator. Remember that humans breathe with negative pressure, and if this isn't clear to you, go and check your respiratory physiology. The iron lung was first clinically used in the early 20th century on a patient who was dying from a respiratory failure related to muscle paralysis due to polio. I just want to point out quickly that the ventilators that you will see in the OR and in the ICU are actually positive pressure ventilation, which is different from this negative pressure iron lung. However, thanks to the development of the polio vaccine in the 1950s, the number of polio cases per year has decreased dramatically to the point where it is an almost unheard of disease in the United States today. Therefore, if you have a patient on your boards with acute onset of paralysis who is from the United States and the question does not mention travel to other countries or lack of immunizations, it is highly, highly unlikely that the answer is polio. However, if you get a question like this, Guillain-Barré syndrome is the most common cause of acute paralysis in the US, and if you're not sure what Guillain-Barré syndrome is, I would refer to the neurology section for more info. So I already mentioned the vaccines. There are two types of polio vaccines available. First, the Salk vaccine, which contains killed virus. Remember the K for killed. It is also called inactivated virus. Second is the Sabin vaccine, which contains live attenuated virus in an oral form. It is also known as oral poliovirus, or OPV. The Sabin vaccine has been the vaccine of choice in many countries. Do you know why the case is? Well, there are several reasons. It's relatively easy to administer since it is oral, and it also induces an immune IgA response in the enteric tract, which interrupts transmission of the virus, because remember, the virus is transmitted by the fecal-oral route. However, because it is a live attenuated vaccine, on very rare occasions, about 1 per 750,000 vaccine recipients, the virus can revert to a wild-type virus with the ability to cause vaccine-associated paralytic poliomyelitis. Here's a summary of the pros and cons of the Sabin virus. Because of this very serious con, it is no longer available in the US and many other industrialized countries. In the US, an enhanced version of the killed vaccine is used instead. Let's move on to the echovirus. Echovirus is another virus acquired through fecal-oral transmission. It can cause a wide spectrum of illnesses, from rashes, mild febrile illnesses, to aseptic meningitis. Suspect echovirus in patients who present with meningitis during the summer to 4 months, without the classic CSF profiles of patients with a bacterial meningitis. If this is foreign talk to you, don't worry because we'll discuss meningitis in more detail soon. I'm going to skip rhinovirus and come back to it in a second. Coxsackie virus is a virus that in humans wears many different hats. In other words, it can present in many different ways. It is the most common cause of aseptic meningitis, far outweighing bacterial causes of meningitis. There are two forms of Coxsackie virus, A and B. Coxsackie virus A is responsible for herp angina, which is a painful blistering infection of the mouth that usually affects children. Coxsackie A also causes acute hemorrhagic conjunctivitis, as well as hand, foot, and mouth disease. Let's talk about hand, foot, and mouth disease. Hand, foot, and mouth disease also commonly affects children and is characterized by fever, followed by sore throat, loss of appetite, and malaise. After the onset of fever, painful vesicles appear in the mouth or throat, and then on the hands and feet, as you can see in these images. Remember that Coxsackie is one of the small number of the causes of palm and sole lesions. Coxsackie B virus is responsible for encephalitis, cardiomyopathy, and aseptic meningitis. It is the most common cause of congestive heart failure in young people. For a discussion of congestive heart failure, or CHF, see the cardiology section. So as you can see, Coxsackie virus can manifest in many different ways. It is less important for you to know whether it is Coxsackie A or B that causes each of these individual manifestations. So last in the picornaviruses is hepatitis A or HIV. I'll discuss this collectively with all of the other hepatitis viruses. Alright, so don't worry, I didn't forget about the rhinovirus. I promised I would get back to it. Rhinovirus is a member of the picornavirus family that is the #1 cause of the common cold. How are you going to remember this? Well, I'm from Africa, so I like to imagine a rhino with a runny nose. There is actually more than 100 serologic types of rhinovirus, with clinical diagnosis made by symptoms. Unlike the other picornaviruses, rhinovirus is acid-labile, meaning it can be destroyed by stomach acid. Therefore, while all of the other picornaviruses can spread by the fecal-oral route and infect through the GI system, rhinovirus is an exception in that it is transmitted via respiratory droplets and direct person-to-person contact. Also, note that since it is a non-enveloped virus, it survives on surfaces such as doorknobs or tabletops, so touching a finger to these surfaces can transfer rhinovirus to your nose. Okay, so that ends all of the picornaviruses. Let's move on to flaviviruses.